Well, good afternoon and welcome to this New Zealand Initiative webinar. My name is Oliver Hartwig. I'm the director here at the initiative, and it's my pleasure to welcome a special guest to our webinar, and that's Professor Des Gorman. Hi, Des.
Hi, Oliver.
We're here to launch your latest report that you have co-authored with Murray Horn. It's Lifting the Lid. It's a critical analysis of New Zealand's response to COVID-19. And must say, we heard you already this morning on Morning Report with Radio New Zealand, where the first question was why you wrote this report. And this would have been my first question as well, because it was a report that we didn't commission. It was a report that we didn't finance. We didn't have to finance. It was a report that you actually volunteered to write because you were passionate about the topic. So what really triggered you to write this report?
Well, in the first instance, Oliver, thank you for the support, nevertheless, since we did write it. Murray and I wrote it because we genuinely cared about the issues, and we were particularly worried about the impact that our management of COVID had had on our society and how it had fragmented our society and caused major divisions and hardship. We wrote it because we had no confidence in the Royal Commission, and I need to explain why we had no confidence. The first is that we thought the terms of reference were far too narrow. The second is the composition of the commission itself. That's no criticism of the three people. They're three very fine people. We just don't think it's an appropriate makeup for a Royal Commission. For example, we think the Royal Commission should have been headed up by a judge, or at the very least, an experienced King's Counsel that can take all the evidence that's presented to them and separate the wheat from the chaff. To appoint a public health professor as to lead the commission, and again, he's a very good public health practitioner, but it signals that this report is about public health issues, whereas Murray and my view was that the public health issues have never been under debate. What's under debate is the way in which they were executed. So we had no confidence, and we have no confidence, that the Royal Commission will address the issues that we cared about and thought needed to be front and centre.
So it was actually the announcement of the Royal Commission that triggered you to write a report. And from what I understand, and having read your report, of course, you want to trigger a massive public debate on this because you believe that actually our experience left something to be desired last time, and we have to prepare for future pandemics and we have to prepare for future emergencies. And therefore, we really have to analyze what happened in the past. Is that the right summary?
Absolutely. It's a very good summary. In the absence of some very, I think, blunt conversations about what went wrong and what went right, we'd be no better prepared next time than we were last time. There will be future pandemics. That's inevitable. It's a matter of when and what sort of organism will be involved. And I think it would be absolutely shameful if we were as ill prepared next time as we were this time. So the learnings have to be quite critical and almost brutal. There's no point papering over this and saying, oh, well, all's well, that ends well. And I mean, it didn't turn out as bad as anyone thought it would. With all due respect, I think it turned out worse. Yes, we didn't have hundreds or thousands of people dying, but the damage to our society and to our cohesion and to our trust in government and media, I think it's very significant. I think the mental health problems that have been incurred are very significant. And so these need to be addressed bluntly.
Yes, and they need to be discussed publicly. So let's hope with this report and this webinar today, we can actually start a public conversation on all of these matters. And at this stage, I would like to invite our audience as well to join us. So we're going to continue this conversation first as an interview, but afterwards I will invite you to really submit your own questions. We're doing that via Slido. So you can log on to slido.com. You put in the event code, which you should have received already, but just in case, it's 316246. You put that in and you can ask your questions. You can vote on other questions, and we will put them to Professor Gorman in the conversation later on. So let's just get into the issues actually. When COVID happened, when it started in 2020, and actually in the final month of 2019 already, there were the first signs. What did you think of it when it first emerged? And did it concern you when it arrived, when the discussion started in around January 2020? And did you think New Zealand was prepared for such an event?
The answer to your question is, at the very outset, I took the cue from virologists and people that I respect it made it very clear that this was not to be dismissed as just a different type of seasonal influenza, and that this virus caused quite different pathological effects. This wasn't a virus which overwhelmed your immune system. This was a virus which actually activated it and caused harm in that way. I was actually overseas at the time in the Middle East, and I came home through Singapore. And those are two countries where I had some influence. And what I noticed immediately is that, having been sensitized by SARS and MERS, they were up and running. They were actively managing borders, and they were actively introducing a whole range of public health measures. And I arrived back in New Zealand, and it was, with all due respect, like a Sunday afternoon barbecue in the backyard. It was as if nothing was happening globally, as though that was a problem over there and not our problem. So I actually made some overtures to central government immediately, saying, you need to close the border today to give yourself breathing space to work out how you're going to manage your border and quarantine and all the rest of it, because you are completely and utterly ill prepared. And the response was, oh, what about trade and tourists? And a system, there's going to be an impact on trade and tourists, but right now you need to close the border, even if it's for a short period of time. Give yourself time to take a deep breath and work out how you're going to manage this. Because what I knew is that we didn't have a pandemic plan. In 2006, the ministry produced a plan of how to plan. The only plan that we can find that resulted from that is a plan about influenza, and it lacks any detail whatsoever. And I also knew that when I arrived back, that our public health system had been found wanting with the measles outbreak. It had failed to address an influenza outbreak, and it also had not met expectations around the contaminated water in Havelock North. Now, that's no criticism of the people in those units. It simply reflects a very long period of underinvestment in public health capacity. So when I arrived back, I was very, very worried, and that concern was aggravated and increased by a very casual initial approach. And when you add, Oliver, our lack of preparation to the incredible indecisiveness of the World Health Organization, the end result is that we didn't go hard and early at all. We might have gone hard, but we went quite late. By the time we closed our borders a month later, over 40% of the viral strains in that first outbreak had been walked into the country by the human host.
Do you believe that New Zealand was uniquely underprepared? How did other countries actually deal with that? I know that in Australia, for example, actually when Tony Abbott was health minister, they worked on a pandemic plan nearly 15, 20 years before COVID-19 happened. The World Health Organization, of course, has a manual for pandemics. Most other countries have such plans in place. Was New Zealand really alone in not being prepared?
Look, I think there were some other ill-prepared countries, but there weren't many. And I think the big contrast to me is that those countries I mentioned that had been sensitized by SARS and MERS, who moved very, very quickly because they understood how quickly these things can occur and how disruptive they can be. But we were spectacularly ill-prepared. Now, we have a whole range of advantage, Oliver. We are a tiny island nation on the bottom of the South Pacific, so we are isolated by one of the world's great moats. We don't live on top of each other. We don't live in high-density housing. We don't live in buildings which have a common ventilation system. We don't live with our animals. We have a very mild climate, so we're outside a lot. So geographically, demographically, culturally, we were in a very good position to do very, very well. And maybe that underpinned some of our complacency, that these were problems that other people had to experience.
And these were problems that initially only happened on our TVs at night when we watched pictures from China, when we watched what happened in Italy, what happened in New York, but it didn't seem to affect us at the time. And then suddenly everything happened within just a few days.
Yes, well, also at that stage, as I say, you might remember how indecisive the United Nations was. They were grappling with even calling it a pandemic for quite a while, but that reflects the fact that those of us who know the World Health Organization know that it's a very political organization, and so it was very frightened of offending certain member states. And so they tiptoed around what this was until quite late. And I think that encouraged us in our complacency. But when we then decided to react, we went from complacency, backyard barbecue mode to forecasting tens of thousands of deaths. And this abrupt change went so that the New Zealand public went from ground zero complacency to blind panic and fear and deep anxiety about becoming sick and dying. So we actually made this extraordinary transition in a short period of time, stimulated, I may add, by some, I think, not credible modelling. So we went overnight from complacency and that's a problem that the Chinese have exported to Europe to, oh God, we're all going to die.
Do you have an idea what actually drove this change in New Zealand's attitude? My impression was actually that in the beginning, politicians had to be driven to action. And it was a group of business people at the time, I remember, actually offering help to the government and urging them to do something. So the government initially didn't seem to be particularly active. They didn't take the lead. They had to be driven to action. Is that right?
Yeah, that is right. As I mentioned, when I raised the issue, the feedback I had from the government people I was talking to was, oh, hang on, we logistically, we can't close the border. We don't have the ability to close it. What about trade? What about tourists? What about students? What about? So the first response was it was all too hard and that the return on that hardness or that hardship wasn't worth it. The next thing I think is that the government really was driven to this by several things, not the least of which was lobbying from some of the public health people, as well as business people. But I remember listening to the Prime Minister when she announced that we were going to take measures, that she said she was influenced by her friends on Facebook who told her how grim things were where they were. And I was struck by two things about that. One, that a Prime Minister would make decisions based on what her friends on Facebook were saying. The other is just that what sort of a dinosaur I am not to realise how influential social media had become in decision-making, even at the highest possible level. So our rhetoric of being off the mark early, early and hard is a fiction. We reacted late, belatedly. Our reaction was hard. And in fact, our reaction was inhumane, but it certainly wasn't proactive and early.
So we've already identified two distinct phases, really, in New Zealand's response to COVID. The first was being relatively blasé, uninterested. This is something that happens to other countries, but not to us. The second phase, where the private sector, parts of the private sector, were actually urging the government to respond. But then we quickly move into a completely different third phase, and that is where the government really takes control, and where the government, as you write in your report, politicizes the issue and uses it as an issue also perhaps for electioneering, because it was an election year and suddenly the government wanted to be seen as extremely active in all of this. And it's this third phase that your report particularly criticizes, where you say, actually, all of the management of COVID was way too political. We should have actually left it with the experts.
Yeah, that's precisely right. I think, and we're not the only country that did this. Some other countries actually politicized it to a greater extent, and usually with very bad outcomes. And the three countries I can think of immediately are Brazil, the UK, and the US. In those countries, the politicization was even greater still, and the outcome was even worse still. But in our country, look, politicians had to be involved, Oliver. We were having our freedom of movement and our freedom of association constrained. Now, that has to be a political decision. But politicians then began running the day-to-day governance of the reaction, and that's where things went pear-shaped.
Yeah, I was going to ask you, actually, can you give us a few more examples of the politicization that you have in mind? What in particular were the decisions that really irked you then and still irk you now? Where do you think politicians should have actually stepped aside?
Well, I think once they had decided on a basic strategy of minimising disease and delaying a peak until a vaccine was available and we were vaccinated, and until the health system capacity had been increased to the point where we could deal with the surge, that's when they should have stepped aside and allowed people who were competent in day-to-day governance and confident in day-to-day management to take over. It was their job to actually choose the strategy, but it was not their job to try and execute that strategy. And of course, the great irony was that 18 months later, when the big Delta outbreak occurred in August 2021, there had been a vaccine available since the beginning of the year, but only 20% of us were vaccinated. The health system capacity was materially no different from what it was in February 2020. So after 18 months, this very sensible strategy of minimise and delay were abjectly failed, not because it was the wrong strategy, but because of very poor execution.
Related question on that. You mentioned, of course, in the beginning, nobody really knew what kind of virus this was, how serious it was. At what stage do you think it became clear what we're really dealing with? That it is not another bubonic plague, that it is something which has now proven to be more closely related, as you argue in your paper, actually, to the common flu than to a massively dangerous virus or disease like the bubonic plague was?
Yeah, well, it's had some different courses in different countries, and the mortality rates have varied profoundly. In New Zealand, the mortality rate's quoted at 0.01%, but it's probably half that because we suspect that at least half the cases have never been reported, so that when you adjust the denominator for the real number of cases, the mortality rate falls, well, halves.
Can you put that into perspective for us? I mean, what mortality rates would we be dealing with something like the common flu?
Well, the common flu kills about 1 in 10,000 people each year.
Mm-hmm.
The reason why we can't directly compare the death rates is we have no idea how many influenza cases there are each year. Although these diseases are notifiable, the reality is that most cases aren't notified. So we don't know the denominator flu influenza. We simply know it kills about 1 in 10,000 people, whereas what we're dealing with this particular bug, let's assume it's affected every single New Zealander, and that's probably a reasonable assumption, then it's probably 5 times less lethal on a whole of country basis than influenza. But that's almost certainly overstating its virulence because we don't know the number of cases of influenza.
I was only asking because I wanted to get a sense of proportion, really, and also because I wanted to just illustrate that this was something different in the end than what we probably feared in January or February 2020.
Well, look, even in February, we knew that this was not influenza. We knew that this virus causes disease in a very different way than influenza does. And my virologist colleagues made it clear to me that you had to stop thinking about influenza and start thinking about a virus which had a very different effect on our bodies. We used modelling, though, Oliver, to project what would happen. And the model we used came from the Imperial College of London, and every single study of that model shown that it significantly overestimates risk. So we had a model which from the get-go, people outside the Imperial College were saying that model overstates risk. We then took data from northern Italy and from other parts of Europe to actually put into that database. Well, the demographics and culture of northern Italy and New Zealand couldn't be much more different. And so we took overseas data and used a modelling system which everyone else, other than the modellers themselves, thought was a recipe to overstate risk. And we used that to generate risk projections. And then the government used the outer range of those risk projections. You might remember the forecasts of tens of thousands of deaths. And then later on, the claim was, look how well we've done. We haven't had tens of thousands of deaths. Well, that's only a remotely credible statement if you take the original risk estimates literally, and quite frankly, I would not recommend that to anyone.
But by the time that New Zealand realized the true nature of the virus and the true nature of the threat, we were already on a different path, and there were path dependencies, and there was already this political machinery now in motion. So how would you have actually handled this at this second or third stage of COVID in perhaps mid-2020?
Yeah, in mid-2020, that was when the politicians should have stepped away and created a governance group of people with governance expertise to run it day to day. And that's at the stage where we should have looked at how we manage biosecurity risk. The irony of all this is that we know how to manage complex entities. We do it all the time, and to minimise the political impact on delivery. We know how to deliver very nuanced biosecurity risk management. We do that all the time. And it's basically a process where the relevant expertise is called up, regardless whether they're privately or publicly employed. And in this case,
but that management of biosecurity that you are just talking about doesn't happen in the Ministry of Health. It happens in the Ministry of Primary Industries.
Yes, but it also happens that if you're the right expert for the job, irrespective of who your employer is, there'll be a contract with you to solicit your services in the event that they're needed. Now, in this case, if you take vaccination as an example, this is the example that Murray and I use in our report. It starts off with extraordinary delays in contracting, inexcusable delays in contracting. And then we have the myth put out that we were standing aside as a responsible nation to allow nations of greater need to be vaccinated first. Well, that's unacceptable from a national perspective, but quite frankly, I think that's a myth just to cover the fact that they had done so poorly with their contracting and supply.
By the way, do you have an explanation of the delays? Why did they do so poorly?
No, I think to date, we've only had confabulation about why the contracting went so badly. And there's a story to be told there, but that story needs to be told by Pfizer, not by people in New Zealand who couldn't get the contract in place. And I think the next thing then is in terms of delivery and supply, you go to a company like Freightways and say, can we borrow some of your logistic experts? And you go to Foodstuffs and Woolworths and you say, can we borrow some of your supply chain experts? And you put together a group which actually knows how to deal with demanding logistics and supply. And in the case of vaccination, you then say, well, who knows the community? Well, the district health boards don't, and the Ministry of Health doesn't, but I'll tell you what the GPs do, and the primary care networks do, and the iwi trusts do. So you go to the primary care providers and say, can you identify your vulnerable people, please? And will you vaccinate them? And we'll give you a lump sum, but we're going to claw back for everyone you don't vaccinate. So were the GPs involved? No, not until very late. Did we call upon expertise in logistics and supply chain? No, we didn't. We asked a ministry, which with all due respect, has no real operational background. And again, I'm not criticising them. They should never have been given the task to carry out this complex task of vaccination. And then to make it even worse, we just go to a very unscientific descending age cohort approach. Whereas after the vulnerable people, the next group that should have been vaccinated were the people who we knew were the primary disease vectors, and that's young adults between 25 and 40, whereas we left them till actually almost last.
You're absolutely right. We have some of the world's best logistics companies in this country. We have the main freights and freightways of this world. We have fantastic operations in our supermarket sector. I think it was even worse than what you just said. It's not just that the government could have contacted them and asked them for help. It was actually that many of these companies actually contacted the government and offered the help on their own and were basically told that they were not needed because the government had it all under control. So this lack of engagement with the private sector, I think, was a continued feature of our COVID response. Would you agree?
You're absolutely right. One of the things that started leading to social division was the disappointment that many people had about offering their services and them not being accepted. That's exactly right. But see, once you have politicised the response, then you need to have a monopoly on the truth, and you need to be seen as that group that is solving that problem. When people become anxious and fearful, they naturally look to authority for comfort. When people are anxious, they endow people in authority with special abilities. And that endowment, as you know, occurred for the Prime Minister and the Director General of Health. They were endowed. And then we engage in confirmation bias, where we only pay attention to those bits of information which support our endowment. So once the government became locked into this political management, it was almost impossible for it to extricate itself, because it had created the narrative that it in fact had special powers to manage this on our behalf and to keep us safe. In the 2020 election, the public obviously agreed with them and voted en masse to support them. So that political narrative and that monopoly on the truth and that look at us, how good a job are we doing, made it.
And it didn't leave much that was not politicized. I mean, even the question who would get a visa for this country, and we had cases, of course, of DJs visiting several times, and that was a political question whether they would get a visa. We had, I think, visa issues for the Wiggles coming for a tour in New Zealand. Everything was suddenly political. So it was really difficult to get the government and the political aspect of government out of any of these aspects of COVID, because by that time, everything really was under government control.
Oh, totally. The New Zealanders trying to get home and having to face a lottery is one of the many examples of how our society divided. That rhetoric of a team of 5 million might have helped recruit people to the cause early on and made them feel good about themselves, but it eventually became a point of derision because we weren't a team of 5 million.
And that is one of your main concerns, really, reading your report. You think it has actually divided New Zealanders, it has actually made political discourse more difficult, and it has had long-lasting effects that will probably be with us long after COVID is gone.
Yeah, I think that's true. If you think about what a liberal democracy depends upon, free, frequent and fair elections is one of them. And of course, we saw the oldest democracy in the world almost tip that proposition over a couple of years ago. It also depends upon an opposition which has the ability to actually provide critical commentary on the government. Well, that, of course, they were completely sidelined once the pandemic response committee was closed. And in fact, any comments from the political opposition were seen as almost being unpatriotic. We then rely upon the media to provide a critical voice. But in fact, with one or two exceptions, as Murray and I point out, the media simply maintained the government's propaganda. Now, clearly they thought that was the right thing to do, to have a coordinated national response. But their job actually is to shine a light on what the government does and to hold them to account. And finally,
we had a bit of an example this morning, actually, when you were on Morning Report.
Yes.
So you mentioned to Chris Hipkiss that, Ingrid Hipkiss, that of course not everything the government announced during the COVID years was true, and it almost came as a revelation to her that there were some things that were not quite clearly communicated in the time. Actually, would you mind to give us some examples of that?
Yeah, well, at the very beginning, of course, we were told there was plenty of influenza vaccine supply, there was plenty of PPE supply, nurses weren't doing split shifts and so on, and yet we find out later on that the centre knew all three of those statements were false at the time.
And the media didn't really cover it at the time.
No, well, one or two members of the media did, but the reality was that by the time the OIAs divulged or declared that these things were wrong, was weeks and weeks and weeks later. And the response was, well, yes, but we've recognised that problem and moved on. So one of the points Murray and I make is if you look at the key performance metrics on things like contact tracing, etc., they didn't move on at all. They didn't improve at all across 3 years. Mm-hmm. No improvement whatsoever. So one of the consequences of politicization is a loss of agility and adaptability. And you can understand why. If you're the best in show and as you know, there's a Greek saying that those who the gods wish to destroy, first they make proud. Hubris is dangerous. We're the best in show, look at us, we're the envy of the world. It makes us feel good. It appeals to that inferiority complex New Zealanders have and our need to be seen as being more than what a country of 5 million could be. So we were more than happy with that hubristic approach, but the problem with hubris is that it leads to complacency, and it makes it very hard to learn and adapt, because every time you adapt, you're acknowledging that someone's doing something better than you are. And the final thing about hubris is it inevitably leads to propaganda. And propaganda is what I was trying to explain to Radio New Zealand this morning. It underpins those falsehoods.
I want to now bring in some questions we got from our audience, and the first questions are rolling in. Just as a reminder, if you want to ask your own question, log on to slido.com and type in the event code, which is 3161246. That's 3161246, and ask your own questions. The first question we have here is, do you agree that MB's failed MIQ booking and lottery system highlighted the public sector's failure to engage with the private sector to assist in the response? So in other words, would it have been better to outsource the whole system and actually let a private sector operator take care of managed isolation and quarantine?
Yes, I do. Clearly, the decision to quarantine people in hotels in the Auckland CBD was a mistake. There's no other way to describe that. Hotels, as you know, are designed to bring people together, not to isolate people environmentally. So you couldn't choose a worse venue, and to do it in the middle of the CBD, Auckland CBD, was just simply a mistake. Yes, look, consistent with my view that these sorts of responses need to call upon the most expert New Zealanders, regardless of how and who they're employed by. We should have gone to those groups best able to deliver the response we needed in an efficient manner. There is, I think, is a truism of centre-left governments that they are anxious about privatising anything. And for example, every time you look at a better private-public interface in health, the argument is, oh, this privatisation by stealth. And you want to sort of grab them and say, the health system's already essentially privately delivered, for goodness sake. GPs exist in a private model. Almost half of elective surgery is done in private hospitals. A lot of advanced technology, radiation and radiation oncology is already done in private facilities. For goodness sake, what we're looking at is publicly funded, privately delivered healthcare, where the premise is value. How do you deliver better care at a lower cost? Or how do you deliver the same care at a lower cost? So it's all about value. So from a value proposition point of view, going to private providers about quarantine made sense from the beginning. The idea that you'd actually put them into hotels and then, for goodness sake, round up serving members of the armed forces to start acting as patrol dogs, whose idea was that? I mean, it was simply this aberrance that the current government has with anything that's not within the public sector.
Was probably also because the armed forces were at least a bit better at executing policy than the Ministry of Health that had previously been in charge. I actually wonder whether you wouldn't agree that the case for MIQ became much weaker over time, and especially when people like Sir Ian Taylor demonstrated that home isolation was perfectly feasible. Wouldn't it have been a much better idea to actually phase out that system much earlier than the government eventually did?
Yeah, countries like Taiwan introduced home quarantine very early. And one of the things I was arguing about very early in the piece was technology-based home quarantine. People who coming back to Taiwan were required to go home and isolate at home and to test. And they used their phones and other tracking methods to make sure they were at home. And there was no contact tracing over the phone. People were knocking on their door to make sure that these people actually were home. It was an obvious idea to follow the Taiwanese lead and look at home quarantine from the get-go, using the technology we all have in our pockets, our mobile phones or whatever. And again, it was this, by that stage, we're already locked into this self-congratulatory, we're the best in show death spiral, where we simply were not prepared to look at who is doing this better than us, and can we adopt what they're doing.
But that would have also probably required some trust on part of the government that people will actually comply with the system. And at that stage, there didn't seem to be much trust. I mean, even Sir Ian Taylor really had to fight for his trial.
Yeah, although the level of trust in the hotels, as you know, there was mixing and mingling, there was parties, there were groups heading out for exercise, mingling with groups coming in. So it wasn't exactly the most rigorously policed environment. And then we found out people were at the border, weren't being tested all the time, that people were leaving quarantine without being tested. So with all due respect, it was, I think, if you describe it as lax, you're being generous.
Mm. Another question from Slido, and once again, reminder, slido.com 3161246 is the code. Here's a question more generally. Japan didn't enforce lockdowns or mandate vaccination due in part to its constitution. So why was New Zealand's Bill of Rights, on the other hand, so frequently ignored?
Our government quickly resorted to authoritarianism, and Murray and I described it as quite a flinty authoritarianism. And once they engaged in that process, it was extend or bust. And moving to a more relaxed, nuanced, and trust-based system became less and less of possibilities. They went further and further down that rigid enforcement approach. And obviously, somewhere someone thought that this was the way to garner public support. Although I have to say, given the army of public relations experts, the exercise of the daily announcement or the weekly announcements of levels from the pulpit of truth was one of the poorest examples of public management I can think of. But in terms of vaccinations, Oliver, our view was and still is that we should have said, in the event that you are vaccinated, you can go and get a haircut from a vaccinated barber. In the event that you are vaccinated, you can go down to the local vaccinated coffee shop and have a coffee. But what we did instead is we said, none of you will enjoy any freedoms until everyone is vaccinated. So those of us who were vaccinated developed an instantaneous hatred for those that weren't. And those that weren't, their deep fears were justified. This was a government push to have them magnetized or introducing some sort of tracking device or to change their genetics. So our division into the vaccinated and unvaccinated became an antagonistic and very hateful one. And it reflects a comment that Murray and I made, which is that our pandemic response was designed, governed and managed by people who don't understand human behaviour, because it lacked humanity. So if you'd said to the public, in the event that you get vaccinated, these are the privileges you can enjoy, that's an empowering point of view. But to say to the community, none of you will have any liberties until everyone's vaccinated, there's only one outcome of that, and it's not a nice one. It's an antagonistic, divisive one.
But not every country handled it the way we did. And the question we just had was about Japan. Were there any other countries you believe that did it better than us? I mean, you mentioned Taiwan, of course, already. Many Asian countries that had experience with SARS and they knew how to respond to such a new virus. But are there any other examples around the world where you would say, well, actually, this is a pandemic response from which we probably could learn something for future events?
Well, I think most of the learnings will come out of Southeast Asia, because that's where they were sensitised by SARS and MERS, from countries like Vietnam, for example, as well as Singapore, which went through some phases. We can learn about natural immunity acquisition through what happened in Sweden, about whether at the end of the day, that particular experiment ended up with less harm than our processes. We can learn from the UK and the US that you can't run hot and cold and try and change course, strategies in mid-course and not have bad outcomes. So we can look across the globe, and there are very good examples of what to do. The Germans, for example, as you'd expect, had fantastic databases, contact tracing, etc. Whereas our contact tracing, we were supposed to be able to identify, contact and test anyone of interest within 4 days. And the target that Isha Varel suggested was 80%. I think that's very responsible. We never got above 50%. Oliver. We never got above 50%, not just during the first outbreak, but during the second and third and so on. So you look at the way in which democracies like the Germans handled information management, you say, that's the way to do that. So I think as you compile a repertoire of good behaviours, it's not a matter of there's a country will follow. What you need to say is these are the bits and pieces that will aggregate into our response.
Well, I'm not sure the Germans got everything right during COVID. They were probably a bit better at contact tracing, admittedly. But the one thing I think that really helped them and saved them was that they had 10 times the number of ICU beds per capita compared to New Zealand. So sometimes I actually wonder, and I would like to know what you think, that actually all of New Zealand's strategy, this very hard strategy, was a result of just being afraid of not having the capacity to really deal with any half-serious outbreak, simply because our system is already running at capacity and we couldn't have fit that in.
Yeah, look, the only strategy we could adopt was minimise and delay. And the reason why minimise and delay was the only strategy we could possibly have was because of the limited capacity of our health system. As you say, the Germans have 10 times more intensive care beds per capita. The Australians have 3 times more intensive care beds. Now, you can buy the beds, but you can't buy the workforce. Our real problem is a shortage of critical workforce, and that's been coming for a long time. So our minimise and delay strategy was the only one we could do, which makes the lax border control, the poor quarantine, inadequate contact tracing and testing and so on inexcusable. Because if you are trying to minimise and delay, you need to do everything possible to minimise. And in fact, our processes to minimise left everything to be desired. So, and as I mentioned to you before, when the big outbreak came, the Delta outbreak in August 21, only 20% of us were vaccinated, and our health system capacity was not materially different. So minimise and delay failed because, in fact, the things that the delay was supposed to enable never occurred.
When you look at New Zealand today, where do we stand with regards to COVID? I mean, it is obviously not over. We have, I think, about 15,000 cases roughly per week. I think last week we had about 30 deaths. I mean, previously in previous phases of COVID, that would have been cause for alarm. And now it's one news story among many. We have become used to it, or maybe COVID has become used of us. It's become endemic. How do you see us today? Are we still dealing with it in the appropriate way? Is it time to really now say, well, look, this virus has become totally endemic and we just let it run? Or do you still think there is a case for some degree of caution? And how do you actually regard the political and public discussion on this? Because we seem to have moved on. We're hardly talking about it anymore.
Yeah. I think one of the problems about being a hermit kingdom as we became is that at some stage you need to open the doors or reintegrate with society. And that's going to be a point at which there is going to be a upswelling in disease. That's inevitable. And we saw that, didn't we? When we opened the doors, there was a significant outbreak of disease, whereas many other countries had already been through that particular process. So there was always going to be an adjustment phase as we came to terms with the nature of this virus, and it went from pandemic to endemic. Now, people like Michael Baker are saying at the moment we're into the 4th phase of the pandemic. Well, it might be the 4th or 5th, who cares? What he's accurately describing is an upswing in the disease again. And we'll have these as people are reinfected by old strains and as new strains emerge. But you're quite right. We've gone from a situation where we would have been in a blind panic and locking ourselves away forever to now shrugging our shoulders and saying, well, this is the way things are. And you have to say, if this is where we've ended up, what was all that hardship for?
Was it worth it?
Well, precisely. Those people who died alone, those people who couldn't attend their loved ones' funerals, women who were alone after they gave birth. If I look at, there's been a recent big survey, Oliver, of general practitioners and around the world, and our general practitioners are just as anxious and worried as they are in Northern Italy or Germany or the UK or the US, despite the fact that their experience of COVID was a lot less. And the answer is when those early modelling projections were made, everyone, including the health workforce, was very, very scared. Doctors and nurses expected a tsunami of diseases that were going to overwhelm the system and they were all going to get sick and a lot of them are going to die. And they're still persistently anxious. So that level of anxiety, that mental health, the financial consequence, you have to ask now, given the attitude we've adopted to this virus, was that hardship actually worthwhile? And of course, it's easy to say in retrospect that we've paid too high a price.
Well, that's precisely the question that the Royal Commission should also answer, isn't it?
The Royal Commission, I think, will disappear into the weeds of the public health debate about which mask is preferable and whether you wear it with around your ears or you're tired or whatever. I think the public health, the Royal Commission, it'll try and avoid the debate around vaccine safety because that's a rabbit hole you'll never emerge from. And it will simply get embedded in the public health measures. Now, the irony is...
So would you scrap the Royal Commission?
Yeah, I would. In terms
or would you have a different commission?
Yes, a different commission with different terms of reference, absolutely. Murray and I made it very clear we don't object to the public health strategy and we don't object to public health measures. What we find inexcusable is the way in which they were executed. We're talking about systems issues here, not public health issues.
Well, the other question is actually the commission, from what I understand, will have a chair who was deeply and intimately involved in COVID commentary and management in Australia.
Yep.
Is it appropriate for such a person to then lead a commission that is supposed to be independent, or would it be a much better idea to actually draw on expertise from countries that actually took a different approach, where they don't have a personal direct implication in our policies? Because otherwise, how could you even come to anything half independent?
Yeah, you're absolutely right. He's a very good public health practitioner, by the way, and he has a deserved reputation. But you're right, he had a lot to do with the Victorian response, and he actually gave advice on
which was very similar to ours.
Yeah, and so it's unavoidable to do anything else than conclude that he has a dog in the fight. He can't possibly be completely independent, no matter how hard he tries. Also, he's a public health doctor, so he'll go to the areas that he's familiar and comfortable with, which won't be social disruption, it won't be social dislocation, it will be public health measures. So the Royal Commission will provide an incredibly detailed report on the type of mask you should be wearing in the future.
Well, if the Royal Commission won't tell us really what happened, and if it won't inform a public debate, then we need people like you, Des, to do that for us. And in that sense, I'm really, really grateful to you and to Murray for writing this report for us. You can all find it on our website at nzinitiative.org.nz. It's called Lifting the Lid. And we hope that it will trigger a debate and a discussion, because one thing is clear, the next virus will come, and hopefully next time we'll be better prepared. And with that, thank you very much to Des Gorman for sharing your thoughts with us today. Thank you to both you and Murray Horn for writing this report, and thank you all for watching this webinar. Thank you.
Thanks, Oliver.
Thank you.